I like to understand how things work and how we can make people feel better. So then I understood that, okay, this is why I wanted to pursue medicine. The people on that side of the world truly understand what it means to be well. Year in, year out, we're seeing more people coming into training. And it's always good to see because the passion that I see people working with is a huge strength. The resources are very important because the resources affect the education of students. It affects the training of specialists. Do not disqualify yourself before you have a chance to be disqualified.
Hello, listeners. Welcome to the You Belong in Here podcast. This is a podcast where we explore the intersection of nursing and racism, racial disparities that African Americans face in healthcare, as well as the inequities that African American nurses, doctors, and nurse practitioners face in the workplace. My name is Dr. Tiffany C. Brown, and I am your host. I am a doctoral level nurse practitioner with more than 23 years of practice in the nursing profession. It is my hope that through hearing the personal stories of triumph and resiliency shared through in-depth interviews from nurses, nurse practitioners, doctors, and DEI experts, you will be empowered in your workplace and know that you belong in here. Now, let's get to our show. Hello, everyone. Welcome to another episode of You Belong in Here. I am, as you know, Dr. Tiffany C. Brown, your host. And listen, I have been in Ghana over the last 10 days visiting, and I decided, you know what, let me tape another episode while I'm here because I was reflecting on the last time I was here, and it was about 20 years ago. And I came in on a healthcare mission trip with my church. This year I came for my birthday, so I thought, let me see if I can talk with a healthcare provider to discuss more about the healthcare system in Ghana from the perspective of a Ghanaian physician. So if you're curious like me about how the system works in other countries, then this episode is for you. Let me go ahead and introduce my guest. The title for today's episode is Navigating Healthcare in Ghana, Insights from a Female Physician. So Dr. Yaa Owusu-Agyeman received her education at the University of Ghana School of Medicine and Dentistry, University of Ghana Business School, and American Academy of Aesthetic Medicine. She is a general practitioner with a focus on aesthetics, having received training and worked in this field since 2019. Now, since 2020, she has also been actively engaging in the health tech industry, where she specializes in developing telemedicine systems and implementing health public programs targeting critical issues such as diabetes, malaria, and cervical cancer. Her efforts culminated in the launch of a cervical cancer awareness campaign across 3 African countries, and her research findings are published in Ghanaian articles. So welcome, Dr. Owusu-Agyeman. I'm so thrilled to have you.
Thank you for having me.
As people who know me know, I usually like to start my podcast with something I call Genesis. So I want to know, what is your Genesis into medicine? Tell us a little bit about your journey and what inspired you to become a physician.
Oh, thank you so much for having me, Tiffany. So I always tell people that, typically as an African parent, you say you have to be a doctor, a lawyer, or an accountant or something like that. It was never like that for me. I really cannot pinpoint what spurred me on to pursue medicine as a young child. But as I actually grew and actually started medical school, I realized it was because of curiosity. I liked to understand how things worked and how we can make people feel better. So then I understood that, okay, this is why I wanted to pursue medicine. But it was never a matter of you have to be a doctor like a typical African child, yes. But before I went to medical school, I actually considered doing engineering. I actually did consider all because of that same curiosity for how things work and how things could be better. But now I am happy that I am medicine and I'm able to merge a lot of my interests together. While I was in my 5th year in medical school, again, curiosity. In our 5th year, we're able to take these elective trips to other countries to, experience health systems elsewhere. So in my 5th year, I went to the Philippines for 6 weeks. So I was in the Philippines working as a medical student, rotations, experiencing health systems elsewhere. Again, curiosity, because from Africa, everybody would say, oh, you're going to go to the US to, experience, because that's, why would she go to Philippines? But that was also the beginning of me understanding the wellness industry. And that was also pushed me into aesthetics because I realized that the people on that side of the world truly understand what it means to be well. It wasn't just about work, 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 work. They understood, taking care of your skin and things like that. So that's another aspect that I really enjoyed. I loved it. But then I came back to Ghana, finished medical school. Here in Ghana, after you're done with medical school, you do what we call housemanship for 2 years. In my second year of housemanship, I was in the emergency. No, my second year of housemanship, I did my master's in clinical leadership and management at the University of Ghana Business School. That also curiosity for how do we actually make the health system work. So that was exposing you to how to actually manage, a health system, how to actually manage an organization that takes care of people's health. There again, curiosity got the better of me. And then after that was completed, and then I went into aesthetics to study in Dubai. There again, curiosity. So it's mostly been about curiosity for me. What can I add on to, shape my path in a way that it's not just in the clinic, but it's a holistic thing. You're looking at the management, you're looking at the pricing, not just the illness, but the wellness aspect of it as well. So that's been my genesis, yeah.
Wow, what a genesis. That curiosity, will keep you learning. I think that we're forever learners. And,
Yeah.
We are supposed to evolve as people anyway, right? So thank you so much for sharing that. Now, I kind of want to get into not the elephant in the room, because we know in number one, in the United States, the percentage of Black doctors is about 5.4%, and the percentage of women is about half of that in the United States. Whereas in the African region, most of the physicians here are Black or African rather, right? Or brown
Yeah.
skin, dark brown skin are Black people. So while we have the disparity in number in the United States, we don't have the disparity in number in Africa, right? However, with regards to the actual number, female physicians account for about 28% of all physicians. I know we'll get into this at some point during this interview, but ultimately there is a lot of gender inequality in African healthcare workers. So, question for you. As a female physician, what unique challenges and opportunities have you experienced in your medical career in Ghana?
I would say that it's been more of opportunities from if I'm looking at it personally. I have been privileged to from my student days to now, to come into contact with people that are older colleagues who had qualified, who had worked, who were very interested in pushing the females to be the best they could. When I was in medical school, there was something they always used to say, the girl child will always do well. Like professors were extremely interested in making sure that the ladies, yes, they are interested in the men as well, but they are interested in pushing the females to be the best they can be. And it transcended throughout my career, and it's still the same. I have been very privileged. But if I step outside of myself and I look at the country as a whole, I would say we still do have some challenges with the girl child seeing themselves as being capable to do certain things. If I step outside of my privileged, bubble, and I look at the country as a whole, I still think we have some work to do with ensuring that every female knows you can be the best you can be. When it comes to physicians as well, in these last couple of years, I am so proud to see a lot of my contemporaries going into the surgical specialties where previously when we were in school, it seemed like, as a woman, you should be a pediatrician so that you would have time. Why do you want to do surgery? But I am so happy to see that it's not the case these days, that the females are going where they want to go, whether it's in general surgeries and orthopedic surgery. It is, whether it even is in pediatrics, it's not just about, I need to make myself in this way so that I can, but it's a decision of what do you want your career to be. So I would say that the challenges have come in a lot more for, balancing as a woman, balancing your life. But I'm happy to see that in general with my colleagues, they are pushing the boundaries and we're going exactly where we need to be, not just because we think that women need to be this or that, but what is it that you want to see for yourself, and you're going straight for that. So that's something that is happening the last couple of years that is really, really good to see. Yes.
Awesome. I love what you were saying about what you have experienced as far as being pushed, seemingly being like well supported and encouraged and empowered as an African going to school, going to medical school. And I think that's awesome and amazing. But of course, like any country, we still have more work to do with regards to women and equality, right? Now I kind of want to segue into the healthcare system in Ghana. How would you describe the current healthcare system? And tell me a little bit about what the strengths are and then some of the weaknesses that you see from your perspective.
Oh, my country, Ghana. To describe our healthcare system, I would describe it as it's filled with passionate human resource that are constrained in an ailing system. The human resource is extremely willing, pushing and pushing, but as with anything else, you are limited within the system that you work in. You cannot do more than what the system is affording you to do. The major strength for us has been that year in, year out, we're seeing more people coming in to train. We see more passionate people coming in, and it's always good to see, because in as much as people leave the country because they want, to study in other fields or get better experiences, we're getting more and more young people joining. And I think that's a brilliant thing for us, because what would happen if everybody grows old and we don't have more inflow? And the passion that I see people working with is a huge strength, because we realize the issues, but we're not allowing the issues to overcome, our passion and all of that. That's a big strength. Another huge strength for us has been that in the last couple of years, there's been an influx. Well, this somebody would say strength or weakness, but there's been an influx of more private investment in healthcare. Now, I'm looking at it as a plus, because I believe the governments cannot do it all. Private people need to invest, because we have people across all forms of the social classes, people coming from outside the country, other African countries, to access healthcare. And I believe that investment has built us up in a way that we sometimes hear of people coming from Togo, Liberia, other countries to come and use the healthcare system here. And the private investments has played a big, big role in that. So we have a lot more private facilities coming up, offering some specialties like interventional radiology, which are not actually, prevalent in our public system. So a big plus has been that the private sector has really, really invested a lot into the healthcare system. That's a big kudos. When it comes to the not so pretty sides, I still feel like, even though the governments cannot do it all, I still feel like the mandate is huge for the government. There's a lot more that they can do. And the first thing has to do with the general insurance that we use as citizens. That I think is the biggest issue. And it's a barrier to access for most people, because the majority of people will not be able to get onto private health insurance. It will not be something that the majority of people are relying on the general insurance that is for all citizens, and then they have to pay out of pocket. The insurance system has not been able to be sustainable, and so it's not doing what ideally we have seen it do in the past. So that's, I think, a big issue that we have. As usual, we have the issue of resources. We have very under-resourced hospitals. When I was a student, we had those issues. But now next year is 10 years for me since I became a medical doctor. And we're not seeing much change with the public hospitals. We're not seeing us catch up with the advancements that the world is catching up with in terms of resources. We're still very much lagging behind. It's quite sad to see. The resources are very important, because the resources affect the education of students. It affects the training of specialists. It even affects the interests of people in various specialties. So I would say that those are the major things, that's the positives and the negatives with our healthcare system. we're looking at better days, and we know that better days are ahead of us. Yes.
Thank you for sharing that. It's important to know and even have an understanding of what happens in different countries and what I hear in our aspect, and we're getting into this, and it happens in other countries too, right? As well as the United States, differences in access, differences and limitations depending on the different states that you're in, even in the United States. So I want to talk a little bit more about your research and work initiatives in cervical cancer. According to the World Health Organization, research shows that the top 3 leading causes of cancer in Ghanaian women are breast, cervical, and ovarian. In the article, you co-authored cervical precancer screen using self-sampling, HPV testing, and mobile colposcopy in a hard-to-reach community in Ghana. This was a pilot study. You researched feasibility of obtaining self-collected specimens for high-risk HPV in hard-to-reach community. Tell me, in your opinion, what are the biggest barriers to accessing healthcare for women in marginalized communities in Ghana? And what was the conclusion of that study and its effect on future practice?
That study really, opened my eyes to see a lot. Through my career, my education, I have seen, remote communities, but that community is actually a community on water. So to come to the mainland means taking a boat, but their entire livelihood is on the water. So I think one of the major issues with access for such communities is that there's this inequitable distribution of healthcare workers that has been an issue in the country for years. And it's mostly because infrastructure is not the same everywhere. So it's difficult to attract health workers to move and stay within such communities for long periods because, let's be honest, they also have families. They're also thinking about where my children are going to go to school and things like that, which are perfectly fine because we all have families at the end of the day. But that inequitable distribution of our healthcare workers, of our resources, is the reason why certain communities are lacking, if I should put it that way. Now, with that community, we actually had to also go on a boat and go there and then teach the women, about cervical cancer, because when we did a survey of everything, none of them had ever heard of cervical cancer. They had no clue what we were even referring to as cervical cancer. Or we're able to teach them about cervical cancer, able to teach them about self-sampling, which people think that is so hard to do. But these women that have barely had any education at all were taught to, take their samples, and the samples were able to be used to do the study, to be tested to screen for the HPV variants. So one of the major things that study taught me was that, listen, we shouldn't have any preconceived notions about what people are able to do because of their educational backgrounds. Even when we started the campaign here in Accra and we said it was self-sampling, a lot of women were not, how will I be able to do it on my own? But that showed me that this is actually extremely simple. And all you really need to do is to show someone that this is it, explain to them, and they should be able to grab it like that. Because where we went to, it was going to be quite difficult to be able to get a place to do the sampling, especially at the first entry that we made, which is why we decided that we would do the self-sampling. The other thing that also it highlighted to me is that this is probably one out of uncountable number of communities of people that have no clue what cervical cancer is. And it was heartbreaking for me, but it's the truth. We sometimes think we've done enough, but sometimes you go to other communities. My work has taken me to a lot of remote communities across the country, and you get to a place and you see that, wow, there's nothing here. And if we were to start educating, we'll realize that these people have no clue about a lot of the things that we think that they should know about. And it's just letting me know that, again, the resources for some of these things, we need to gather more resources. We need to be able to get ourselves together even more to push these agendas, because the numbers we're seeing about, increasing breast, cervical, ovarian, in as much as we will see them in the major cities, we may also be seeing them in these communities, and we may even be losing people even before they're diagnosed because they have no clue what we're talking about. So for future studies, I believe that we have more remote communities that we need to introduce some of these, teach them about these various forms of cancer, also study them, understand the patterns so that they also understand how to protect themselves. I'm really proud to have worked with the Cervical Cancer Prevention and Training Center, which is in the Volta region. If we come to cervical cancer research training, they are the leading resource in the country. And I am so proud to have worked with the brilliant minds that are working there. Year in, year out, they train hundreds of health workers and they equip them to be able to do some of these testing and then colposcopy treatments for the precancerous lesions. So they're doing great work, and I believe that this is an organization that we need to push as much as possible because they have so many articles, they have so many trained nurses, and they're doing a wonderful job. Yes.
Wow. Thank you for sharing that. As an oncology nurse, people know that I have an oncology background for 24 years. But one thing, yeah, I'm an oncology practitioner too. What I can say, oncology is my passion, and especially how the disparities in the African American community. And of course, now here in Africa, I see a very similar disparity with regards to not understanding, not knowing, not receiving information to know properly how to screen and actually do it. Like in the States, a lot of people don't go to doctors, until something is wrong, like really wrong. Even for general PCP, which is your primary care doctor, like annual visits. In Ghana, is that common for people to not even go to like your doctor for an annual visit or have a gynecologist as a female?
Unfortunately, yes. The majority of females only see obstetrician gynecologists when it's time to have a baby or when they feel like they're having difficulty getting pregnant. It's not in, I don't know what to call it, our culture or our tradition or to be seeing them regularly. Personally, I started seeing a gynae regularly maybe about 5-6 years ago, even as a medical doctor myself. So it's not something that is ingrained in us. When we're students, we learn that immediately you have your first period, it's a good time to start seeing a gynae. That's a good time for people to start, seeing a gynae as a woman. But it's not really a part of us. It's in the last couple of years, we see more females because of the message of cervical cancer. We see more females going in to just get checkups, get their pap smears done, get your HPV test done. So we're getting better and better, but as usual, we have to play catch up because it's not been a part of us. We are now, learning that, okay, this is something that I need to do. In as much as I want to check my cholesterol or I want to make sure that my kidneys are fine, I need to take care of my reproductive system as well. I need to have that annual checkup and then follow up consistently with my gynae based on what he or she is recommending. Yes.
Thank you for sharing that. I can go on and on about like the healthcare and how cultural beliefs and practices influence patient care, as well as it affects the outcomes in all communities, right? Like how your belief system. And that sounds like something that I'm hearing you say here with regards to the culture here. Thank you for sharing that. I want to ask you another question because I know we're kind of coming close to our time. More so regarding gender, of course, in healthcare. What role do you think gender plays in the healthcare field in Ghana, both for providers and for patients?
For the providers, there's been acceptance, whether you're this gender or that gender. There's not really much of, okay, yeah, as colleagues, this and that. But when it comes to the patients, not only just gender, but age also plays a role. Imagine people as young looking, even if you've been working for 20 years and you're smallish and you look young, a lot of typical Ghanaians would be like, oh, is this young doctor the one coming to take care of me? And then also as females, the general misconception in this part of the world is that a male is a doctor, a female is a nurse. That is it. So you're going to encounter as females the majority of your patients assuming you're a nurse, which is not a bad thing, but sometimes it makes them not want to listen to you completely because you may have seen a patient, you may have done everything as a doctor, your colleague nurse also comes in, does everything as a nurse, And then your senior colleague walks in and is speaking to the patient. The patient goes, "Oh, I haven't seen a doctor today." And you're wondering, okay, so maybe you've taken a whole history, you've examined, you've even counseled. But then it puts you in a bad light in your senior colleagues' eyes, because then the first impression is, okay, what just happened here the whole day? Have you guys not been working? But then you're looking at your colleagues, doctors and nurses, and you're like, okay, we just went through the whole thing. So I think that a lot more of the typical Ghanaians are slowly accepting that gender has no role to play with whatever you want to do in the healthcare system. Male, female, I can be your lab tech, I can be your radiologist, I can be your radiographer, I can be whoever I wish to be. In Ghana, we have different cadres of nurses and they wear different uniforms. I can be whoever I wish to be. My gender has no role to play, that my age has no role. So that's one of the things that a lot of female healthcare workers go through. Typically, even if it's, when it comes to, if you just look at even our colleague nurses, what I've also seen in my career is that sometimes patients want to listen to the men more than they listen to the women. And sometimes it's like, gender has no role to play here. We have the same training. We're doing the same job, taking care of the same patients together to make sure they get better. Gender has no role to play. But I think that as the years go on, it's getting better and better. Me, when it typically happens, I just smile and I go like, "Oh, I'm going to be your doctor today. These are my colleague nurses or my colleague doctors, and we'll be taking care of you together." Just, it's not something that we, to tussle about. It's just a quick smile, because you understand that it's our culture. In our culture, typically the men take the lead. The men lead, the teams. But it's also nice to see that we have a lot more females that have risen up, that are consultants, leading teams, whether in nursing, doctors, lab techs, pharmacists. And it's lovely to see that it's slowly changing the perception that, the typical Ghanaian has. Yeah.
Good. I believe we have some of the same gender biases in the United States as well. So that's very common. So I want to ask you the question more about technology, because I understand that you have a background in that as well. So how would you say technology and telemedicine can improve the healthcare delivery system in Ghana? Do you all do like virtual visits, like we're doing, we call them video visits? Do you all do those as well here?
Typically, in the majority of hospitals, they don't do televisits. The majority. What we have more of is private entities that have a whole telemedicine system, like what's where I work. So we have a number of private entities that run telemedicine services, but using the doctors and the nurses that we already, like the healthcare workers we already have in the system. In the public hospitals, I would say no. But I know of a couple of private hospitals that are utilizing televisits, because some of their consultants may not be in the country, or they're visiting specialists and things like that. So that's been useful. I have seen telemedicine do absolutely wonderful work across the countries. I started working with telemedicine where I work now. I think we've been doing this for about 3 or 4 years now. And when we started, we were really, really apprehensive about how it was going to be received, especially because we wanted to reach people across the country, not just in the major cities, as far as remote areas up north. In the beginning, yes, people come in, they're questioning, but where's the doctor? They're looking around, okay, where's the doctor? Who's talking to me? But they're like, okay, it's a video visit, it's the same thing, you're going to talk. And we are able to utilize a remote examination tool, which our stationed nurses are using. So the doctor controls it, so you can listen to your heart, look in your ears, into your lungs and things like that. So slowly we've seen some acceptance across. We expected, people that are in the major cities to accept it better. But we've also seen the people in the smaller towns across the country also accept it very, very, very well, and also look forward to coming in to speak to the doctor. So I think it's been able to bridge the access gap that we have in the country, which is not really, we can't build hospitals everywhere because we don't have, unlimited resources. But I see telemedicine being able to bridge the gap where it comes to, lack of access, and also with regards to specialties. We cannot have specialists everywhere. So it's a great tool to be able to lend your specialty advice or your consultations to places that you cannot necessarily travel to all the time, because that's also time. you are on the road traveling, or even if you're flying, you could have used that 40-minute plane ride to see maybe about 5 clients. So these are, I hope that telemedicine gets bigger and bigger in Ghana as the years go on here.
I hope so too. I want to ask you another question. How can our global audience, right, better support healthcare initiatives in Ghana?
I like to see that over the last couple of years, like you mentioned that you came with your church, I have seen numerous people come in to do outreaches and things like that. And it's even more nice to see when they collaborate with the local physicians and the local nurses and the local health workers so that it's more sustainable. I think that with every outreach we have, we need to think about the sustainability. I also see a lot of our homegrown celebrities and footballers bring in specialists from all over the world to come and assist with some surgeries and things like that. And they also collaborate with local specialists. So we are also learning from people that have access to better resources. We cannot compete. As of now, we can't compete when it comes to resources. So I like to see that you guys have more expertise because you have better resources. I would love to see more collaboration across all the specialties to reach more. And then also research. I'm very, very big on research. Anybody knows me that I love to read research articles because I want to know more. And I think that collaborating with us here to do more research would really help us to build our knowledge base and also to learn more from our colleagues out there. I think research is an area where we need to do more. Yes.
Thank you for saying that. I'm going to go back home and talk to some people where I work right now. And show them this video. I think it's important to do research, and I think it's important to help other communities with the resources that we have. Particularly, my passion is cancer. I would love to come back and even educate, do more here. At some point, we can talk about that after this, of course, that maybe we can collaborate. But as we get ready to close the show, I want to ask you, what advice or pearls of wisdom do you have for aspiring female healthcare professionals in Ghana and beyond?
One thing that I would say I didn't get much of, and then I had to, research a lot to find thing was, or maybe I didn't take advantage of, let me put it that way, was finding people that had gone ahead of me in the fields that I wanted to be in and then learning from them. I think that in aesthetics, in the tech space that I work, it was a lot of figuring out and finding out things for myself, which I feel like if maybe I had someone to speak to in those fields already, it would have maybe opened my eyes to certain things that maybe I saw quite late. Researching and all that was great, but finding someone to hold your hand is even better. That is, I also I have an organization with a partner where we also offer some form of mentorship for people that are coming up. I would say be as bold and as confident as you want in the pursuit of what you think is best for you. Do not doubt yourself. Do not count yourself out. If it's something that you want to do, do not disqualify yourself. If it is something you want to apply to or you want to pursue, do not disqualify yourself before you have a chance to be disqualified. I believe in being confident to the point of even cold emailing people that you think can help you out, which I do all the time. If I see on LinkedIn, I see that you may be of help to me, I'm going to cold email you in the shortest, most polite way. You must also be used to hearing no or not at this time, which is something that is going to build your confidence because you realize that the more you do not disqualify yourself, the more you realize that you are capable of so much. You are really capable of so much. And I am hoping that anybody that's wanting to work in this healthcare field, Dr. Tiffany has so many years of experience. I am actually wowed. That's actually really, really great to see. So proud of Black women like yourself. Do not count yourself out. I'm sure she would say the same. Be relentless in the pursuit of whatever you are looking for. Yes.
Yes.
Yeah.
Well, thank you so much for those words of wisdom. Definitely. I could not agree with you more regarding relentless and pursuit of your dream, ultimately, your own vision that you have for yourself. I do want listeners to be able to connect with you and learn more about the healthcare challenges and advancements in Ghana. Will you share with me some links that I can put in this episode notes later so that people can connect with you if they want to learn more?
Yes, sure. I'm on LinkedIn as my full name, Yaa Owusu-Agyeman. On my aesthetics business is on Instagram as well with Hadassah. You can also, you can find me a lot of places actually. You can also email me. My email, I'm sure Tiffany will be able to put it in there. My email is yo and then Agyeman, like you see it, at gmail.com. I'm very open to collaborations, whether be it research, even if it's students looking to have some experience here, because I also went as a student to the Philippines and I had a wonderful experience. So I believe in cross-cultural experience. I think that it opens our minds up to a lot of things. So you can reach me anywhere else. I think LinkedIn would be the easiest because it's easy to see my name and type it in here. So please do reach out. I'd love to speak to people across the world and learn from people. Yeah.
Awesome. Well, folks, this concludes another episode of You Belong in Here. Thank you, Dr. Owusu-Agyeman, for being such an awesome guest, sharing your inspiring and transformational journey of curiosity and your pearls of wisdom with our listeners today. Thank you, listeners, for tuning in. And of course, we hope that this episode reminds you that your presence is necessary. Whether you're in Ghana, whether you're in Spain, whether you're somewhere in Europe, whether you're in the Philippines, your presence is necessary and you belong in your workplace. You belong in your place of education, right? And as usual, if you found this episode encouraging, motivating, inspiring, and empowering anyway, please like it and share it with others. You can find my podcast on YouTube, Spotify, Apple Podcasts. So tune in 2 weeks where we continue to explore topics in equity, healthcare, and equity in the workplace. Thank you all and take care and keep pushing forward. Bye-bye.
Bye-bye.